Good evening, everyone, and once again, thank you so much for joining Roland Connect. What would you say is like the most pressing challenges around water, sanitation, and hygiene in these rural parts of Nigeria?
To start with, I will quickly want to talk about when we talk about water supply and sanitation, we're actually talking about safe water, safe drinking water, safe usage of water. The sanitation and the hygiene aspects are crucial for human and health and also our well-being. It also contributes to our livelihood, our attendance in school, attendance, our dignity. It also helps us to create resilience in our communities, making our environment suitable for us to live. So in the rural community, there are lots of crises, there are lots of challenges that they face. One of it is access to, they lack access. I mean road network. So the other aspects are lacking. What I mean, the other aspects is the toilets and the hygiene, hand wash parts are lacking. So then they don't have adequate information about the importance of having this system in their community. So that means they have low awareness of information on open defecation and hygiene. Then the issue of hand wash. Most times when they come back, the wife give them their food, or they just grab whatever they have, they start eating, and they come up with one ailment or the other. Nigeria has 774 local governments, and 142 are open defecation free. I repeat, 142 are open defecation free. Just in Niger State, there is a serious outbreak in a community. It's suspected too. Do you know what caused it? Because there is no water in a particular community. They now start fetching water from a bowl inside what they call a graveyard, where they bury the dead people. Burial ground. Exactly, burial ground. They start fetching water in a bowl close to burial ground. That is where the contamination comes in, and people in that environment start falling sick.
The health of a community is also tied to the level of hygiene and sanitation they enjoy. So if proper hand washing is not instilled in the minds, as previous speaker was talking about, what did she say? She was talking of behavior. We need to enlighten, sensitize, train, build the capacity of people to understand the relevance of keeping a sanitized life or living a hygiene life. For example, something like, so you identify people, stakeholders who the community listens to, and you train them. You help them to monitor, you help them to do sensitization, you support them to do monitoring, you support them in capacity building of the community, support them with resources and time. And that way, I think you can be able to change the behavior. Behaviors, infrastructures are not being upgraded. That is why you see now every house is having a borehole, because there's a limit to which you can stretch existing infrastructure, and we have reached that limit.
So I want to say a very big thank you to you once again, Mr. Eddie and Mrs. Adeniran, for sharing valuable insights with us this night. It has been value for my time personally.